Hello everyone, my name is David, and this is...
I'm Dr. Feyi. Good morning, everyone. Welcome.
So we are in week 2 of our Women's Wellness Challenge, and today we're going to be discussing women's hypertension.
All right, so you've heard it. Fellow women out there, do you know anyone with high blood pressure? Or do you have high blood pressure? We're going to be talking about high blood pressure today. David has some questions, and I know some of those questions will relate to some of us women. Let's get started.
Okay, so Dr. Feyi, we just want to know what exactly is hypertension?
Hypertension is when the blood pressure is high. Okay? Now, what is high? Today we're not going into technicalities of a whole lot of big medical, words, because we want everybody to benefit from this education that we're given at Lifeguide. So, in simple terms, high blood pressure is when your blood is flowing with very high pressure. So the blood flows in the blood vessel, and the number at which, or the pressure at which is flowing, is supposed to be within certain range. Normal range is supposed to be 120, and the bottom number is supposed to be 80. So if the top number is 140 and above, is high blood pressure, and if the bottom number is 90 and above, is high blood pressure. So we know that there are stages of high blood pressure. There are mild, moderate, high, all those stage 1, stage 2, stage 3, and all those, specifics. But we know that generally, if you go take your blood pressure, check your blood pressure, if the top number is 140 and the bottom number is 90 and above, is high. Now, the top number is when your heart is working, is beeping. That's the top number. When your heart is pumping, that's the pressure at which the blood is flowing. The bottom number is when your heart is at rest. So if your heart is at rest and the pressure is over 90, it's not good. So that's general idea about high blood pressure. And a whole lot of people walk around this world without knowing, called undiagnosed, because there's no way to know if you have high blood pressure if nobody has told you. And even when you know, we can't check your blood pressure one time and say, oh, you have high blood pressure. No. And data has it. So I have this book, Functional Medicine Clinical Protocols for Inflammatory Disorders by Dr. Alex Vasquez. This book says 30% of Americans, as of today, from 2013 to 2023, it has increased from 30% to 47% of Americans have high blood pressure. It has increased from 50 million to 116 million people in America has been diagnosed with hypertension. So it's increasing in an alarming rate. So let's more.
Okay, thank you. So the next question is, how does a person, or how does a woman know that she has hypertension?
Like I said, there are a lot of people that walk around undiagnosed. The only way to know that you have high blood pressure is if you go to a doctor, or if you check your blood pressure and it's consistently high, more than 2 times at different times, then you have high blood pressure. So when somebody comes into the office at Lifeguide and they're rushing in because they were late for the appointment, and then you slap the blood pressure cuff on and the numbers are high, that one time you can't say they have high blood pressure. But if they come today, and then some people say, oh, they have white coat syndrome. You came last month, white coat syndrome. This month, white coat syndrome. You check it at home every morning for a whole week, 2 weeks, 3 weeks, 4 weeks. It's high. And it's not white coat. It's not bedroom syndrome. No. If it's consistently high, you go to Walmart, it's high. You go to doctor's office, specialist, your daughter's home, son's home, your home, morning, night is high. It's high. So without checking it, there's no way to know. So that's the best way, is to check your blood pressure. So please check your blood pressure. Check it randomly. Know if it's good or not. And if it's consistently high, if the top number is over 140 or the bottom number is over 90 consistently, then you have high blood pressure.
So our next question is, what contributes to high blood pressure?
A whole lot of factors, okay? But just in general, okay? Sometimes it's hereditary, okay? Sometimes it can, because everybody in the family has it, it could contribute to somebody having it. Sometimes it's the diet, obesity, okay, inflammation, vitamin D deficiency, mitochondrial inflammation. What is mitochondria? Sorry, I promise not to use big words. With functional medicine, there is no way you will not talk about mitochondria, because mitochondria is the core of our cells, is the powerhouse of our cells, and cells make up, the whole body, through tissue and all that, organs and so on and so forth. But if your mitochondria is the powerhouse, is the core of your cell, is the core of how we function, if it's not accurate, if it's defective, everything else will be defective, okay? So those are the major contributions. So diet, obesity, sedentary lifestyle, these days working from home, you don't exercise, and like I said, some people it's hereditary. And other things that I've mentioned, like the vitamin D.
So our next question is, what should you do if you have hypertension?
So if you have hypertension, you have to talk to your doctor. A lot of people, so we talked about people who are not diagnosed. Millions of people are not diagnosed. But now let me address people who have been diagnosed. People that come to Lifeguide, because we are functional medicine clinic. What is functional medicine? That is when we find root causes of diseases and then reverse it. Hypertension can be reversed. But first of all, you have to find the root cause. There are so many causes of hypertension. It has been established by research that mitochondria, your powerhouse, the powerhouse of your cell, if it's malfunctioning, is connected to inflammation, and continuous state of inflammation can lead to hypertension. Okay? So if, for example, the reason for your hypertension is continuous inflammation, but you keep taking amlodipine, amlodipine will not remove inflammation. Amlodipine will not repair your mitochondria. Okay? If, for example, somebody else's cause of hypertension is on taking medication. So the thing that is different at Lifeguide is we have to find the root cause. Okay, somebody has continuous state of vitamin D deficiency. The doctor, okay, first of all, some people's doctor, they don't check vitamin D level because the insurance will not pay for it, which is sad. But if your insurance doesn't pay for it, go to a private lab, come to Lifeguide, and check your vitamin D level. Your health and wellness is not the responsibility of your primary care physician. If your insurance is not covering it, there's nothing they can do for you. You have to be intentional about your health and wellness. Take responsibility to know what you need to know. So if somebody is in a persistent state of vitamin D deficiency, that can contribute to inflammation, continuous inflammation process. Because another thing is, if your doctor told you 2 years ago, 3 years ago, that your vitamin D level was low, maybe 16, I've seen 14, as low as 14. Okay, the minimum we want is 30. Optimal level is 50. Here at Lifeguide, we don't do minimum, we do optimal. We shoot for the best. We want your best state of health and wellness. So even the minimum, 30. 2 years ago, you were at 17. And since then, you've been taking over the counter when you remember. You're not doing yourself any service. So when you come, we check everything that we need to check. Okay? Now, we're talking about maintaining healthy weight. From this Dr. Alex Vasquez, I'm just going to, hypertension has been around, and I've just told you 116 million people in America have hypertension. There's nothing to reinvent in hypertension. It's everywhere. We know that healthy vitamin D level is important if you have high blood pressure. Okay? Patients should recite their daily regimen, nutritional supplements, CQ10, okay? Quercetin, zinc, all right? Dealing with chemicals, xenobiotics, things like POPs, P-O-P, which is persistent organic pollutants. Do you have pollutants in your house? Such as dioxin, having a long record of causing, contributing to hypertension and many other health problems. So, pesticides, okay? Things that we use every day. What chemicals do you use every day? I'm not going to mention any name, but you have to be specific. The things that you use to clean your house. Don't just buy anything to clean your house just because it's cheap. Sometimes cheap on the counter is costly to you. Be careful what you use to clean. Chemicals that you inhale will contribute to your chronic hypertension, and your blood pressure medicine will not cure your blood pressure. Another thing, weight optimization. See, I said optimization. Healthy weight. Okay, not everybody needs to be skinny. Healthy weight for each person. Some people have long bones. Everybody will not be 100 pounds. Everybody will not be 150, 120. No. Health and weight optimization. So make sure you're within healthy weight. Urinary sodium and potassium. Yes. Okay? People with high blood pressure, you need to be consuming some amount of potassium. Double-blind study says consuming enough potassium every day will help with high blood pressure. Kiwi, banana, blueberry, Okay? And also, effects of diet. What do you eat? Guys, what do you eat? There are 4 major diets. Okay, 4. Number 1, SAD. S-A-D. Okay, Standard American Diet. So sad. So sad. I didn't make it up. Okay? I didn't make it up. Okay, this is experts telling us that's number 1, SAD. All right. Number 2 is we have Mediterranean diet or paleo. Okay. We have vegetarian, and we have another one. What is the other? DASH. Thank you. DASH. See? And DASH diet. Okay. So those are the 4 major ones. So make sure you eat what is healthy. SAD is just you eat it because it's convenient. You saw the adverts. They're having buy one hamburger, get the other one free. A large soda refill is free. It's convenient. I've told you before, don't stop going to the middle of the aisle, because that's when you have your processed food, sugar, and all those things that are bad for you. And that will mess up your kidney. If you're hypertensive, stop eating sad food. Okay? No processed food. Reduce your salt. Reduce your burger. Reduce things like that. Eat more vegetables and fruits. Now, if somebody has, if it's hereditary, okay, look into your mitochondria. Now, if you tell your primary care out there, I don't know if they do functional medicine, I don't know. Ask them, how can I check my mitochondria health? Okay, I don't know. If they can help you, that's fine. But come to Lifeguide, where we'll check your mitochondria health. And we are able to start from there. 80% of your immunity starts from your gut. Gut health, we did that last week. Check those videos out. That contributes to hypertension. And for women, the effect, it can affect the eyes, the heart. You know, I can mention here my mother. I've been working with my own mother. Okay? Her ejection fraction went from 55 to 65. Okay? So that's good news. All right? Mitochondrial health is very important. It's the core of managing chronic diseases. And that's what we do best at Lifeguide. So come on in. Let's work with you and help you and walk with you to your wellness in your wellness journey. I'm so excited for you.
All right. Wow. That was amazing information from Dr. Feyi. She will be posting, or I guess we will post our information down below if you want to find out more information about how to book your appointment. If you have any more questions or comments or concerns, you can feel free to go look at our website, which will be posted. So thank you for tuning in to week 2 of our Women's Wellness Challenge, and we hope to see you tomorrow for another day.
See you tomorrow.